Hello everyone, I am at the Skukuza Medical Practice with Dr. Riboni Maloja. So she is going to tell us everything about the practice, starting with the stethoscope around her neck. Doctor,
Yes.
what do you use that for?
Okay, so this is a stethoscope. We usually just use it to listen to the heart and the lungs.
Okay.
Sometimes you can also use it to listen to the stomach if there's any bowel sounds. So it's basically just an amplifier
Okay.
of internal sounds. Yeah,
Okay,
mostly
so
lungs and heart.
why do you have to listen to the sound?
For diagnosis, so if somebody's sick, for cold, if there's infections in the lung, you can hear if there's water in the lung. You can hear if there's an infection, if the airways are closed because of mucus. You can also hear different, if there's a hole in your heart, you can also hear that. So it's different things. So it's different sounds for different diagnoses.
So it means you must know these different sounds.
Of course.
Oh,
Yes, yes. So in school, we had to even train our ear, would listen to the different sounds on some computers. Yeah, yeah. So you need to know exactly what the sound means.
All right.
Yeah. Okay. So usually when a patient comes in, we sit over there, I take a little bit of a history, and then when it's time to examine them, we move over on the bed. They'll come and sit on the bed for me. We'll do vitals, which is your blood pressure, your temperature, your sugar. For the older patients, I'll take the sugar. Then we'll also do a malaria test. So everything that I use for that is over here. All my blood pressure cuffs are in here. I have the temperature probe here. Then this is the machine that I use for shaking the blood glucose, which is sugar. And then I'll usually do a malaria test if I'm suspecting malaria as well. Yeah.
So why do you have to ask about their history? You spoke about asking about their history before you start helping them.
Because I need to know what I'm looking for.
Oh,
so
okay.
I need to talk to the patient so that I have a picture of what kind of disease I'm already thinking of. Because it doesn't start on the bed.
Oh.
I need to hear how long it's been, family history, if it runs in the family, what medication they've been taking, because people can be coming to me because they're having side effects from medication as well. So I need to know exactly what's going on so that when I come on the bed, then I know what exactly I'm looking for.
Okay, so what if it is critical, or maybe they've been stabbed or shot? What do you do?
That one is straightforward.
Okay,
trauma is straightforward.
Okay, that is trauma.
Yeah, that's trauma. So if it's trauma, if it's something that's obvious, somebody is obviously bleeding, we don't waste time sitting there asking you. So I usually just go straight on the bed, then you explain to me what happened while I'm busy examining you and helping you. Yeah.
Alright. So what is this? What do you use this for?
So this is an eye chart. It's usually just a screening test to check the eyesight. Okay. So the patient will stand there, and then I ask them to close one eye at a time, and then they read each line, so I can see how bad their vision is. So usually normal people have vision up until there.
20 out of 20?
Yes, yes. So this is what I use for that. This is an old BP cuff. I don't use it anymore because it doesn't work. But it's just for blood pressure. And then we throw all our medical waste in there because you need to dispose of medical waste in a specific way. You can't just throw it in a normal dustbin. It needs to go through specific burning and all of this because it's all blood and all infectious stuff in there. And then also our needles have their own waste management as well.
Okay, so you don't just take it out. There are specific people who come and take this.
Yes, for infection control and all of that. Yeah.
All right.
Then I have all my syringes and medications. Here I keep all my emergency drugs. If there's an emergency, I usually have everything that I need there. If not, then it's in the other room in that big container.
So do you always check if you have enough, or maybe there's somebody who checks?
Yes. So me and Binigo, we check.
Okay.
Every week we make sure that it's fully stocked.
Okay.
That I have everything that I need. Yeah.
All right.
So this is our pharmacy. Luckily, we can dispense medication. So when I see my patients, you don't have to take a script and go to a pharmacy. We just give you whatever is in here. We have literally almost everything. We have good pain medication. We have almost all the antibiotics. Everything that our patients need, they can get in here. So we just divide it according to exactly what we have. Our flu medication on this side. We have our skin stuff down here, the soaps and the aqua creams. Then we have our asthma pumps also. We have some antibiotics, everything.
So is this practice for everyone, or maybe only people who have medical aid, or if they want to
We
pay?
take cash. We can take cash.
Oh, you take
Yeah,
cash.
we
So
take
it's
cash.
either you pay cash or maybe you have
Yes.
medical aid.
Yeah.
Okay, so
Yeah.
it's not for free.
No, it's definitely not. It's definitely
Okay.
it's not a public practice. Yeah.
Oh, okay.
Yes. So
All right.
you have to either pay cash or medical aid.
All right. Okay.